Surgery in patients with acquired immunodeficiency syndrome (AIDS) requires careful consideration due to their immunocompromised status, increased susceptibility to infections, and the potential effects of human immunodeficiency virus (HIV) related complications on surgical outcomes. Here's a detailed discussion. Preoperative considerations. 1. Assessment of immune status. Measure CD4 plus T cell count to assess the degree of immunosuppression, 500 cells milliliters. Minimal risk of immunodeficiency related complications. 200 to 500 cells moderate risk. 200 cells high risk, considered AIDS. Evaluate viral load for understanding disease progression and predicting outcomes. 2. Comorbidities. Common in AIDS patients due to opportunistic infections, e.g., tuberculosis, pneumocystis pneumonia, and HIV-related malignancies, e.g., Kaposi sarcoma, lymphoma. Monitor for complications like anemia, coagulopathy, or renal and hepatic dysfunction. 3. Antiretroviral therapy (ART). Ensure adherence to ART, as it reduces complications and improves immune function. Assess for drug interactions between ART and perioperative medications, e.g., anesthetics, antibiotics. 4. Infection screening. Screen for active opportunistic infections, e.g., cytomegalovirus, candidiasis. Provide prophylaxis for common pathogens if indicated. 5. Nutritional status. Malnutrition is common and negatively impacts wound healing and recovery. Address deficiencies with supplementation or dietary interventions. Intraoperative considerations. 1. Anesthetic management. Use medications with minimal interactions with ART. Monitor closely for complications like hypotension and arrhythmias, which can occur due to underlying HIV-related cardiac issues. 2. Infection control. Strict adherence to aseptic techniques to prevent surgical site infections, SSIs. Use of barrier precautions to protect the surgical team from exposure. 3. Surgical technique. Prefer minimally invasive approaches when feasible to reduce recovery time and complications. Handle tissues carefully to minimize trauma, as AIDS patients often have fragile tissues. Postoperative care. 1. Infection prevention. Antibiotic prophylaxis, tailored to the patient's risk profile and local microbial flora. Monitor for signs of SSI, pneumonia, and catheter-related infections. 2. Wound healing. Delayed wound healing is common in AIDS patients due to poor immune function. Use advanced wound care techniques, e.g., vacuum-assisted closure, antimicrobial dressings, as needed. 3. ART continuation. Ensure resumption of ART as soon as feasible post-surgery. Monitor for adherence and adjust for any perioperative changes in medication regimen. 4. Nutritional and supportive care. Provide high-protein diets and supplements to support recovery. Address psychosocial factors like depression, substance abuse, or lack of social support that may impede recovery. 5. Monitoring for opportunistic infections. Remain vigilant for late-onset infections, e.g., mycobacterial or fungal infections, in the postoperative period. Types of surgeries in AIDS patients. 1. Emergency surgeries. Common indications include perforated viscus, intestinal obstruction, or appendicitis. Outcomes depend on the patient's immune status and presence of active infections. Elective surgeries include hernia repair, cholecystectomy, and cancer surgeries. Generally safe if the patient is on ART and infections are controlled. 3. Oncologic surgeries treat AIDS-related malignancies like Kaposi sarcoma or lymphoma. Multidisciplinary approach with oncologists is essential. 4. Reconstructive and cosmetic surgeries performed for conditions like facial lipoatrophy due to ART. Require careful patient selection and planning. Outcomes and prognosis. Improved outcomes with ART. ART has significantly improved surgical outcomes in AIDS patients by reducing viral load and enhancing immune function. Complications. Increased risk of infections, delayed healing, and longer hospital stays compared to non-HIV patients. Prognosis. Favorable if immune function is preserved, CD4 200 cells per milliliter, and infections are well managed. Ethical and legal considerations. Surgeons must ensure informed consent, including discussions about the increased risks of surgery in immunocompromised patients. Address potential stigma and discrimination, ensuring equal and respectful care. Surgery in AIDS patients requires an individualized approach with meticulous planning and multidisciplinary collaboration to optimize outcomes and minimize risks.